This week's review of the 21 skills. Hand washing. We wash our hands for how long?
20 seconds.
How many paper towels?
3.
The first paper towel is used to do what?
Dry.
Second paper towel.
Clean up water.
Third paper towel.
Clean the area.
We're going to wash up to hour.
Wrist.
We're going to wash under hour.
Fingernails.
And
Cuticles.
range most to the shoulder. I'm going to take the shoulder
Up.
and
Out.
and elbow and wrist. Bend the,
Elbow.
twirl the,
Wrist.
and both
Directions.
go up and
Down.
3 times.
how many times, Dominique?
3.
Range most to the hip, near ankle. I take the leg what?
Up.
And
Out.
and
In.
knee,
Bend 3 times.
ankle.
Flex up and
down.
Reposition the resident. We reposition the resident how often?
Every 2 hours.
To prevent what?
Bed sores.
And to provide.
Comfort.
The first pillow will go where?
Behind the belly.
The second pillow. Third and fourth pillow.
Under the arms.
We want to make sure we raise the resident head back up because they're going to have difficulty.
Breathing.
I'm going to put the call light in what hand?
The head that it lean on.
Y'all see how they play in class? Okay, a normal pulse is,
60 to 100 beats per minute.
a normal respiration is,
14 to 20.
hello, I'm here to check your,
Vitals.
but you're going to pretend you're checking though.
Pulse.
For how long?
1 minute.
Okay. Measure record urine output. So remember how to drain this urine bag right here. We have to remember it by doing what? We're going to pull the
Panties down.
then we're going to
Pee.
open and then
Close.
and then
Wipe.
and then
Pull the panties back up.
and then we're going to put the urinal on a,
Flat surface.
we're going to measure to,
Eye level.
our gloves are still on, so we're going to take everything off, take off our gloves, wash our hands, then give Miss Rose the
Call light.
lower the
For
bed,
safety.
and you're going to wash your hands before and after the skill
And then record.
and record. We record, and each small line represents how many cc's?
25.
So if it's at 200 on the third line, how many cc's is that?
275.
Okay. Feed and record a resident. You will fail feeding if you fail to do what?
Sit the pressure.
If a person is choking, what would you perform?
How
What is By doing what? Abdominal thrust. If they're pregnant or obese, you're going to do it where?
in the chest.
Okay. Ambulate means to what?
Walk with the patient.
After 2 to 3 steps, you're going to do what?
Ask them their pay.
Okay. Transferring the patient from the bed to the wheelchair. You will fail if you don't have the wheelchair
Lock.
and in place. And you're going to fail if the bed is not what?
Lock.
And lower.
Okay. You will fail if the person don't have on what?
Shoes.
While they're in the...
Bed.
You're going to put the resident head all the way.
Up.
Okay. Then you can safely transfer them from the bed to the wheelchair. Mouth care with teeth. We just doing what? Offering what? But the head of the bed need to be all the way.
Up.
Denture care. I'm going to put what in my sink?
Why
Why would I put it in there? A cloth. Why? So they won't break. Then I'm going to put what in my denture cup?
Cold water.
I brush the dentures, rinse them off, put them in the denture cup. Before I perform mouth care, I need to go ahead and do what first?
Change your gloves and wash hands.
Change your gloves, wash hands, and put on more gloves. Then you're going to offer mouth washing.
Water.
Before you leave, you're going to leave the dentures where? Hand and nail care. What I'm going to do to the nails, I'm going to,
Soap.
and then I'm going to,
Clean up the nails.
and then I'm going to.
File.
And for hand care, I'm going to do what?
Wash.
And,
Rinse.
and,
Dry.
and,
Wash lotion.
and.
Wipe with excess lotion.
For foot care, you're going to do what to the feet first?
Soap.
Then I'm going to,
Wash.
and,
Rinse.
and,
Dry.
and,
Lotion.
and.
Put on the top. And then put on the top.
Remove the excess soap, then put on socks. They racing like they finna get a prize. We change the occupied bed. We just move everything in the wet of the bed.
Middle.
Okay, we put the resident on the bedpan. We done put her on the bedpan comfortably. We gave her some tissue to wipe herself, raise her head back up. Took off our gloves, wash her hands. She's ready. You wash your hands, put on gloves, come back in the room. But before you remove that bedpan, you are going to...
Wash your hands.
Yes, people forgive that. Give them a hand wipe to wipe their hands. When you're dressing a patient with a weak arm, you're going to undress what side first?
Wrong side.
And you're going to dress what side first?
Weak side.
Catheter care. Don't get afraid when you see catheter care. You're going to remember 4 steps. Step 1 is to
Wash
the wet.
Vagina.
Step 2 is to wash.
the catheter.
Step 3 is to change the.
Pad.
Step 4 is to check for.
Keys.
Perineal care is wet.
Poop care.
So I'm going to do wet first. Step 1 is to.
Pad.
Step 2 is to.
Clean the vagina.
Step 3 is to.
Wash the body.
Step 4 is to.
Change the pad.
Partial baths consist of the upper part of the body only. I'm going to wash wet first.
Eyes with no soap.
Eyes and face with no soap. Then I'm going to wash, rinse, and dry the
Neck.
and
Chest. Stomach.
and.
Arms.
Now I can turn the person over. Now I'm going to wash the back of the
Neck.
and.
Back.
What am I going to put on the back?
Lotion.
I'm going to remove the.
Excess lotion.
I'm going to change the.
Gown.
I'm going to change the.
Gown.
I'm going to change the.
Pad.
And I'm going to put her on a clean
Gown.
then.